What was the biggest difference between last year's ViVE event and this year's? AI, of course. That's right, the biggest difference was AI. Now, I know what you're thinking. Didn't I say that AI was the hot topic at ViVE last year? Well, yes, I did. But this year at ViVE 2025, it was a little different. Let's get to it. Hello, Colin Hung here for Healthcare IT Today, and I'm coming to you from Nashville, Tennessee, where we just wrapped up ViVE 2025. Now, people call Nashville Nash Vegas, but with the weather during this year's event, it could have been called Boston. It was cold and it actually snowed here. But despite the weather, ViVE turned up the heat and set the tone for the spring healthcare conference season. What were my key takeaways from this year's event? Well, as usual, the production value of ViVE was spot on. There are not many conferences on the healthcare circuit that have this level of branding. I mean, everything here was branded. And of course, being Nashville, they had live country music in the lobby instead of a DJ blasting out the tunes like they had last year in LA. And actually, that's a great metaphor for the difference between AI at ViVE 2025 and 2024. You see, last year, AI was an assault on your senses. Everywhere you looked, there were wild claims about what companies were doing or what they were planning to do with AI. This year, in Nashville, things were different. Just like country music. Simple rhythms and melody. AI this year didn't overwhelm me. At ViVE 2025, I found that companies were much more focused in their AI claims. Many I spoke to actually had evidence, actual studies and data to back up their AI claims. They even had customers willing to give first-hand accounts on how much AI was really helping them. The AI melody here at ViVE 2025 was definitely more grounded. And that was my big takeaway from this year's event. What were my other key takeaways? Well, one key takeaway came from a company called Ambience. The company dropped some big news during ViVE 2025. The AI scribe market is pretty crowded. There are a lot of players who are dominating that particular market, companies like Microsoft Nuance, Nabla, and Abridge. Those are the three that I see everywhere. And after ViVE 2025, I have to add Ambience to that list. An announcement dropped here that Cleveland Clinic had selected Ambience as their AI scribe after a very comprehensive bake-off between all the market leaders. One of the deciding factors was how strong Ambience was at handling specialties. Another was how the notes being generated by Ambience were clinically excellent and well suited for revenue cycle processing. I sat down with Ambience co-founder Nikhil Beduma to learn more about their announcement. Here's a small snippet of that conversation.
I do think the question you asked is top of mind for a lot of folks. Is this a commodity? One of the organizations that we work with, Cleveland Clinic, they just announced their 5-year exclusive partnership with Ambience this morning. They wanted to put that to the test themselves. And so last year, they did what most people would think was crazy. But they decided they were going to run a 5-way evaluation across all the leading players in the field. And the question that they were trying to answer is, are there any differences between these technology players? And so they identified 100 plus clinicians across 40 different specialty areas, had a cohort of those physicians actually try every single one of those platforms. They collected data across the integration, the experience, clinician satisfaction, burnout, time savings, adoption across those specialties and subspecialties, as well as can you see measurable time savings in the EHR, and can you actually see a positive financial ROI from implementing the technology? They actually presented some of the results here at ViVE yesterday.
Another interesting piece of news that dropped during ViVE 2025 was the partnership between Kairos Health and Abundant Health Acquisition. Kairos Health brings together disparate information from legacy systems at healthcare organizations and makes that data available for all sorts of patient engagement applications. Abundant Health Acquisition uses clinical and administrative data to build retail-like experiences for patients that are seamless and matched to the patient's health status. I caught up with Paul Dean, CEO at Abundant Health Acquisition, and Dr. Graham Gardner, founder and CEO at Kairos Health. I wanted to learn more about their new partnership, and here is a bit of that conversation.
As a patient, you're going to see much faster access to the right provider with availability that's closest to you within a couple of clicks from Google. You're gonna search on Google, you're gonna hit a service line page, and you're gonna immediately see those providers that are near me, or I can change it, and their availability. So that's the provider benefit, or the patient benefit. The provider benefit is really around operational efficiency and spending much more time, again, activating, optimizing their marketing programs, and less time integrating and potentially digging themselves into technical debt.
And I think for us, Colin, it really brings the directory to life. I think what AHA really helps to do is to contextualize who you might want to see as a provider with content about a certain condition, so you really feel like you're getting this holistic opportunity to understand the condition and find out who's right for you. In many ways, I see this as we did the first generation of Kairos, where we would talk to clients about the fact that, look, data management is a commodity. Like, this is what we do. Let us do this so you can spend your calories doing other things. And I think now this is the next step of that evolution to say, look, there's now a platform to democratize how you can begin to think about building digital experiences. Let us do that, and you and your team can spend your calories doing even bigger things on top of that.
While I was at ViVE 2025, I also had the chance to visit with Genzion. I've had my eye on them for a while, and I finally had the opportunity to learn more about how they are helping their customers. Here is Harsh Singh from Genzion with more.
Hi, my name is Harsh. I'm here at Genzion, and we are talking about at ViVE 2025 the launch of our co-pilots for physicians and for nurses. Among the physician co-pilot, we are using risk stratification to help health systems as they're thinking about value-based care contracts, identifying which patients may need what capabilities, whether they want to be seen in person or telehealth based on the disease progression that they may be facing. We are identifying the disease progression using AI and Gen AI and helping the health systems identify which patient should come in to the office and how soon they should come into office, so the health systems can take care of them and hence reduce the overall cost of healthcare in the country. Thank you.
One of the most interesting conversations I had here at ViVE 2025 was with Adam Mariano, President and General Manager of Healthcare at LexisNexis Risk Solutions. Adam is an advocate for improved healthcare access, and I wanted to ask him for his advice on how we can continue to push for better health access when equity initiatives are not very popular at the moment. Here's a short clip from our conversation, and I think you'll be interested in his response.
They're not the same thing, and you could certainly have an access program be part of a DEI initiative, and I know there's a lot of friction right now around those initiatives in the space, but we've had access problems. We've had access problems in the U.S. forever, and they're issues across the spectrum. So, place of service. Is there a place for me to go get primary care or specialty care anywhere in a commutable distance to my front door? There's cost. There's time of day if you don't have sick time, or you can't leave the office during business hours. Are there night and weekend hours for you to go to a visit? But there's also all the thresholds of access because of barriers to care around your coverage, or the fact that that specialty just isn't managed in a location you live in, and the only place to go is to a large-scale health institution in a tertiary research center in New York City, for argument's sake, and you're in the middle of the country. Those initiatives have been a struggle all along, and they're the things that drive quality of care. They reduce the cost of care. If Colin can't go to a primary care visit and ends up in the ER and ultimately admitted to the hospital, you're talking a 10 or 100x cost in delivering care. And as we've seen the primary care market sort of dry up, you're watching community health systems struggling, tiny little margins. You're watching all the pharmacies bought up a bunch of primary care and then divested a bunch of primary care, and I think incidentally created new service deserts.
Here are a few more people that I connected with while here at ViVE 2025.
Hi, Bonnie Bruner, Client Success Manager with Clinical Architecture here in Nashville at ViVE25. Like a lot of people, we are hearing a lot about AI as well. It seems to be incorporated in kind of everyone's pitch and what they're looking for. Also hearing a lot about care at home. So bringing healthcare directly to the consumer at their home. So that'll be interesting to see how that plays out.
Hi, my name's Scott Stewie. I'm President and CEO of Direct Trust. It's really good to talk with you today. I got to tell you, ViVE is such an exciting place. We're seeing so much interesting stuff. Yesterday, there were several things that were kind of back to back that were really all about identity, digital identity used in the healthcare context. Really exciting new partnerships between our members and folks on the identity side of the fence. This is really the biggest thing that's happening, in my view, in healthcare today, is that identity is improving, and we're going to see healthcare information move more easily and people be more satisfied and comfortable with how data is being shared and with whom. So we're excited about that effort and really excited to be here.
Hi, this is Stephanie Broderick from Clinical Architecture. I'm EVP of Provider Solutions, and definitely hearing a lot about AI. We're very close to the AI theater. Also a lot related to interoperability. For us personally, we try to steer the conversation to, AI is great, but you've got to have a good data foundation in which to do AI. We have kind of a cute little saying at Clinical Architecture that AI on bad data is artificial stupidity. So those are the conversations that we're really having.
My final takeaway was the attendance. The event felt a little lighter than usual, and I think that was partly because the weather disrupted so many people's travel plans. But also, I noticed there were very few government attendees. I didn't see anyone from the VA or any branches of the military or anyone from HHS, FDA, CMS, ONC. I mean, given what's happening with budgets and the job cuts, I think many of those who maybe planned to come a year ago wisely chose to stay home this year. So ViVE 2025 didn't feel quite as busy as 2024, even though I think the official attendee numbers were roughly the same. However, I will say that it was a lot easier and better to connect with people here in Nashville because of the smaller size. So I found that this year's event was even better than last year's. So I just want to say that ViVE 2025 was a great conference, lots of interesting applications of AI from companies who have proven success stories with it. There was still an overwhelming amount of focus on AI, but at least it was much more grounded this year. I really enjoyed being here in Nashville, Tennessee, and I learned a lot from all the great people that I met here. I can't wait for ViVE 2026 back in Los Angeles. This has been Colin Hung for Healthcare IT Today. Thanks for watching this, and I'll catch you on the next video.